Welcome, friends. We are revising homeopathic remedy Graphites. Its common name is black lead, amorphous carbon. Kingdom is mineral kingdom, and the remedy was proved by Dr. Hahnemann. We are dealing here with part 1 PQR review, and the text comes from the Allen's keynote, and this is a good revision for homeopathic BHMS students and interns. I am Dr. V.K. Chauhan, homeopathic physician. This is the textbook which we are following for Ellen's keynote, and this is the text which is given in Ellen's keynote. So let us go and see what this text is about. This text is based on the hearing's guiding symptoms, and the symptoms are given in running text. There are no grades are given as what we see. 4 grades are given in guiding symptoms of hearing. Here each sentence represents a PQR or red line symptom. The drawback or limitation of this particular text is that it is disorganized in sequence and continuity. On going through this entire text, we find that Graphites is presented about in 25 PQRS or 25 sentences. And they are: number 1 PQR is suited to women inclined to obesity who suffer from habitual constipation with a history of delayed menstruation. Here, the text tells us about the physical component of the constitution, Graphite's constitution, and also tells us about the diathesis. They are prone to develop obesity, constipation, and history of delayed menstruation. PQR2 tells us about what pulsatilla is at puberty, Graphites is at climacteric. So it again tells us about the phase of the life when this particular medicine is important, and it is having the differential from pulsatilla here. So again it talks about the diathesis of Graphites. PQR3 tells us about excessive cautiousness, timidity, hesitates, unable to decide about anything like what we find in pulsatilla. So this particular PQR is about the temperament aspect. And the temperament, what we find here is a timid temperament of Graphites. PQR4 tells us about fidgety while sitting at work. It is a mental general, and we find that it is denoting the restlessness. PQR5 tells us about sad, despondent, music makes her weep, thinks of nothing but death, and music is intolerable. What we see, similar symptom in natrum carb and sabatilla. It is a mental general. So predominantly this patient can go into the depression, and nowadays what we find, it may be a case of bipolar disorder. PQR6 tells us about eczema of lids, eruption, moist and fissured. Lids are red and margins covered with scales or crusts. So it is a particular general. From the skin region, the area affected is the face around eyelids. So it tells us about the moist eruptions is acute dermatitis or acute eczema. It can be airborne contact dermatitis, or the patient who is using cosmetic, they can cause this kind of a presentation. PQR7 tells us about sexual debility from sexual abuse. It is a ailment from general debility, but it is more in the sexual field, so it is a sexual debility, what we find in case of Graphites. PQR8 tells us about menses too scanty, pale, late with violent colic, irregular, delayed from getting feet wet. Getting feet wet, delayed menses is ailments from, and the menses are scanty and painful tells us about the dysmenorrhea. Next PQR is 9, morning sickness. During menstruation, very weak and prostrated. The menses causes great weakness, general weakness, and morning sickness during the pregnancy. So similar symptom we find elum, carboanemilis, and coca. PQR tells us about leukorrhea, acrid, excoriating, occurs in gushes day and night, before and after menses. Here differential is before menses sepia, after menses creosote, and this is a particular general, especially from the female sexual area or female genitals, you can say. PQR 11 tells us about hard cicatrix remaining after mammary abscess, retarding the flow of milk, cancer of breast from old scars and repeated abscess. So in the breast region, there are scar formations which affect the flow of milk and repeated scar, old scars, repeated abscess, they cause predisposition to cancer formation, CA breast. PQR 12 tells us about healthy, unhealthy skin. Every injury suppurates like hip herself. Old cicatrix break open again. Eruptions upon the ears, between fingers and toes, and on various parts of the body from which oozes a watery, transparent, sticky fluid. It is acute eczematous condition. In case it can be associated with scabies also. PQR 13 tells us about the nails are brittle, crumbling, deformed like antimonium crudum, painful, sore, as if ulcerated, thick and crippled nails are there. PQR 14 tells us about cracks, fissures in the end of fingers, nipple, labial commissures of anus between the toes. Now we go to PQR 15, burning a round spot on the vertex. Similar symptom will be in the calcarea sulf. Cold spot can be seen in cases of sepia and verbascum. Now we go to the PQR 16, cataleptic condition, conscious but cannot without power to move or speak. Is a physical general, and then we find PQR 17, takes cold easily, sensitive to drafts of air. Similar symptom we find in borax, calcarea, hyper, and nux vomica. It is a physical general. PQR 18, suffering parts emaciate. This is also a particular general, but it can be taken up as physical general because any part can get affected. PQR 19 tells us about hears better when in a noise. When riding in a carriage or in a car, when there is a running, rumbling sound. Similar symptom we encounter in nitric acid. It is a particular general symptom in the hearing area. PQR 20 tells us about diarrhea, stools brown, fluid, mixed with undigested substances, and of an intolerable odor, often caused by suppressed eruptions. So this is a symptom which is coming from GIT section. It is a particular general, but there is a causation also, suppressed eruptions like sorinum. We go to PQR 21, chronic constipation, stool difficult, large, hard, knotty, with lumps united with mucus threads, too large like sulfur, smarting, sore pain in anus after a stool. It is a particular general GIT section. We go to PQR 22, children imprudent, teasing, laugh at, reprimands. It is a mental general, especially in reference to children. And PQR 23 tells us about the sensation of cobweb on the forehead, tries hard to brush it off. Similar symptom is present in baryta, borax, bromium, ranunculus sclerosis. Now we go to PQR 24, phlegmatus erysipelas of face with burning stinging pain commencing on the right side, going to left after application of iodine. We go to PQR 25, decided aversion to coitus in both sexes. Relationship we find complementary causticum, hyper and lyco. Graphites follows well after lycopodium, pulsatilla, after calcarea in obesity of the young woman with large amount of unhealthy adipose tissue. Follows sulfur well in skin affections and after sepia in gushing leukorrhea. Similar to lycopodium, pulsatilla in menstrual troubles. Aggravation is at night, during and after menstruation. So this is the total text what we have seen under Ellen's keynote. Friends, thank you very much. Thanks once again. Share and care.